Hi, I am Dr. Felice Gersh, your integrative OBGYN physician. Guess what? September is PCOS Awareness Month. And I'm very excited because PCOS is the most common endocrine disorder of reproductive age women, the most common cause of infertility in women. In September, we explain a lot about PCOS. Now, what am I going to talk about today? Estrogen dominance. Did you catch that? Estrogen dominance. If you have never heard that term, what would it conjure up in your mind? What kind of thoughts? Well, the way I first thought of it when I heard those words was a woman is making too much estrogen, okay? And it's dominating her health in a bad way. It has negative connotations, not good connotations. And most people don't know this, but estrogen is not a hormone. It's a family of hormones. In fact, in the human female adult, there are three estrogens: E1, estrone; E2, estradiol. Estradiol is the estrogen made by the ovaries during the years of the reproduction, capabilities when women make estrogen from their ovaries. It's estradiol, E2. And then there's E3, estriol, the dominant estrogen of pregnancy made in large quantities from estradiol in the placenta. So estrone and estradiol can go back and forth between one and the other, but when you have a lot of inflammation in the body, it actually downregulates the enzyme that converts estrone into estradiol. So you end up with much more estrone. Now, each of these estrogens has different effects on estrogen receptors, and only estradiol has a balanced effect on all of the estrogen receptors. Now, I don't want to spend time dealing with the different estrogens, but I just think if we're going to talk about estrogen dominance and then PCOS, because that expression, estrogen dominance, is used endlessly. I cannot tell you how many talks I have heard talking about estrogen dominance and polycystic ovary syndrome. But it won't make any sense if I don't kind of talk about what estrogen dominance even means. And in order to even understand the concept, which, by the way, right up front, I hate the term estrogen dominance. I want it to be eliminated from the vocabulary. And I will elaborate in a minute more on that one. So, there are these three estrogens that are present in the human adult female. There's another one, estradiol, that's in the fetal liver. We're not talking about fetal livers right now, although it is available as a pharmaceutical, but we won't go there today either. Now, when people talk about estrogen dominance, darned if I know what they particularly mean. I actually went and looked it up, of course, Googled. I went to Google and said, okay, what is the definition of estrogen dominance? I wanted to see what Google came up with. And basically, I call it a hodgepodge of pointlessness, okay? It said too much estrogen. It could mean that you have too much estrogen for any reason whatsoever. This is important because when people hear the expression estrogen dominance, all they think is evil estrogen, down with estrogen, too much estrogen. Well, what kind of too much estrogen could you have? Well, you might be making too much. So where would you be making too much from? Well, we don't go into that in Google at that point. We'll come back to that. So you're making too much estrogen. Remember, there are multiple estrogens. You are not eliminating estrogen properly from the body. You're not getting rid of it. And we'll come back to that. Another one is you're getting too much estrogen-like chemicals known as xenoestrogens or endocrine disruptors from the environment. These are chemicals that mimic estrogen but combine to estrogen receptors. That somehow gets also into the mix of estrogen dominance. And then the last one is, well, you have too much estrogen relative to progesterone. So that could be estrogen dominance. You don't have enough progesterone, but you have too much estrogen. Or maybe you don't have too much estrogen, you just have not enough progesterone. So you have a more dominance of estrogen relative to progesterone. So basically, it's a pretty darn meaningless expression, but it grows fear in public and doctors and other healthcare professionals alike, because it's just like, oh my gosh, too much estrogen is a bad thing. Well, let's go into it in a little more detail, and then I'll link it back to PCOS. If you are making too much estrogen, well, then you have to say, what kind of estrogen are you even talking about? There's only one time when women might actually make too much estrogen, estradiol, from their ovaries, and that's perimenopause, when sometimes there's these shoots up and down, and there could be an overshoot. And that's because the brain, which has sensors to estrogen, says, oh, we don't have enough. So through the pituitary, it sends the signals to the ovary to make more estrogen. And sometimes the pituitary sends out too high an amount of FSH, kind of like when you're trying to collect a whole bunch of eggs for like egg freezing, or you want to do IVF, and too many eggs get ovulated, usually two. And then you get too much estrogen because you have two eggs ovulating, and then each one of them is responsible for making more estrogen. That's the only time when you actually have the ovaries making too much estrogen in the form of estradiol, unless you're doing a targeted intervention to try to get multiple eggs to be ovulated. We're not going to go there now either. Okay, well, let's go back to PCOS. We just are going to start with PCOS. Polycystic ovary syndrome patients do not do what I just said, okay? That is not what they're doing. They're not over-ovulating. They're under-ovulating. They usually don't ovulate. That's the big problem. So that's not a cause of estrogen dominance in a PCOS patient. So why would anybody say PCOS is a condition of estrogen dominance? It's not because their ovaries are making too much estradiol. In fact, the ovaries of women with PCOS make too little estradiol. The way that estradiol is made in the ovaries is that it starts with specialized cells in the ovary that make testosterone. Testosterone then travels to another group of cells in the ovary. We'll get into more detail another time. And then under the influence of FSH, follicle stimulating hormone, you activate the enzyme in the ovary called aromatase. And aromatase is the enzyme that converts androgens into estrogens. All estradiol in the ovary comes from the transformation of testosterone made in the ovaries into estradiol made in the ovaries. And the transformation involves the enzyme aromatase. Women with PCOS do not do that conversion well for a whole variety of reasons, also yet to be completely understood. They have too low a level of FSH, too low a level and activity of aromatase, so they do not convert testosterone adequately to estradiol. So you end up with this imbalance. You can make plenty of testosterone, no problem there. So the brain keeps stimulating through luteinizing hormone made by the pituitary under the direction of the hypothalamus of the brain. The ovaries are stimulated to make more and more testosterone. That's why women with PCOS typically have high LH to FSH. They call it the LH-FSH ratio. Too much LH relative to FSH. In a healthy reproductive age woman, except at ovulation, it's typically 1-to-1. They're about equal. In women with PCOS, it is often 3 times higher amounts of LH relative to FSH. So you end up with this imbalance of too much testosterone, not enough estradiol. Clearly, that is not estrogen dominance. Okay, well, if you don't ovulate, I said women with PCOS don't ovulate regularly. That's part of the big problem. Then you're not going to make any progesterone in the ovary unless you ovulate. So you'll have some estradiol, but it's not normal. It's not adequate to the task because estradiol is the hormone of life. It modulates, turns on and off, regulates every system in the body. It's phenomenal. That's why I call it a life hormone, not just a sex hormone. So women with PCOS actually make too little estradiol. And of course, since they're not ovulating regularly, they make too little progesterone. Labeling that estrogen dominance makes absolutely no sense. Okay. So, what about elsewhere in the female with PCOS? What does she do? Typically, women with PCOS have an abnormal amount of adipose, aka fat tissue. Now, fat tissue also has the enzyme aromatase. What activates the enzyme, turns it on into high mode, high gear, is inflammation. Women with PCOS tend to have lots of inflammation for a variety of reasons. And I'll deal more with that in another one of my talks this month on PCOS Awareness Month. But for the moment, suffice it to say, women with PCOS have chronically elevated levels of inflammation. Inflammation turns on, upregulates the enzyme aromatase everywhere except in the ovary, particularly in adipose fat tissue. Now, what is the dominant androgen? It's DHEAS, and there's others like androstenedione. They are coming predominantly 100% DHEAS from the adrenal gland. The adrenal gland contributes far more of the androgens into the bloodstream. So, when you have inflammation, and women have inflammation galore when they have PCOS, and they have excessive adipose tissue, even the so-called lean or normal weight PCOS women, if you did a body composition, what do you find? Excessive amounts relative to their muscle of adipose tissue in their viscera, around their middle, and inside the internal organs and in the abdominal cavity. That's called visceral fat. So women with PCOS, even the lean ones, which make up about 20% of PCOS women, have too much adipose tissue, and it's not healthy. Now, women who are overweight and obese, which make up the majority of women with PCOS, and we'll talk about why that is also in another program. So women who are overweight or obese have obviously excessive amounts of adipose tissue, particularly in the belly and internal organs and in the peritoneal abdominal cavity. And when you have lots of inflammation, which is what is occurring in women with PCOS, it turns on high mode the enzyme aromatase. So the circulating androgens, predominantly from the adrenal gland, are converted into estrone, E1. Now, estrone is not evil, but it has very particular effects that are different from estradiol. And when you have too much of it, it creates a pro-inflammatory environment. The estrone operates primarily on the alpha receptor of estradiol, and the alpha receptor is the dominant receptor to stimulate growth, or what we call proliferation, and activate the innate immune cells. These are the first responders of the immune system, and they create inflammation, the purpose of which is to help you if you're traumatized or dealing with an infection. But here we're not dealing with either. We're having uncontrolled inflammation. Like I said, we'll talk about why that is in another show. And you're having upregulation of this enzyme aromatase, which is making large amounts of estrone. Now, when you have a lot of inflammation, it somewhat blocks the enzyme that would normally help to convert estrone to the better, what we want, estradiol. So you get stuck with a lot of estrone. Now, could you call that estrogen dominance? Yes, you could, but people don't understand if you say estrogen dominance that the estrogen that we're talking about has nothing directly, only indirectly, to do with the ovaries, because when you don't make enough estradiol in the ovaries, you end up with more inflammation throughout the body. Like I said, you become metabolically unhealthy and more systemically inflamed. So lack of adequate estradiol, you might say estradiol insufficiency, is one of the causes, a big cause, of having too much estrone produced by the adipose fat tissue of the woman's body, the women with PCOS. But when women are told you have estrogen dominance, or doctors tell other doctors in writings or in lectures, PCOS is a condition of estrogen dominance, people don't know what that means. Most of them, and I've talked to many, these are healthcare professionals dealing with women with PCOS. They think it's because the ovaries are making too much estrogen. Some of them don't even know what kind of estrogen comes from the ovaries. Everything I just told you, they don't even know it. So they think the ovaries of women with PCOS are producing too much estrogen. I'm not sure what kind. Okay, but if you knew, then you'd have to say too much estradiol. The exact opposite happens. And they're not even thinking it's coming from fat tissue, which is being stimulated to make estrone from circulating androgens through the activation, upregulation of the enzyme aromatase. So what do I suggest? Stop calling it estrogen dominance. Now, what's another thing that can happen in women with PCOS? I don't want to forget this part. Women with PCOS seem to carry higher levels of endocrine disruptors. The one that's had the most research is BPA, bisphenol A, okay? That is a ubiquitous everywhere. Everyone has this chemical toxic thing in them, which is found in hard plastics, can liners, and it was also on those funny cash register receipts. And BPA is a huge endocrine disruptor, not just for estrogen, but even for testosterone and melatonin. Now, they've done some studies on adult women with PCOS. If you test everyone, they're going to have some BPA in them. The body can eliminate it pretty quickly, but there it comes right back again because we live in an environment that's loaded with BPA. So women with PCOS, that doesn't mean they're exposed to more BPA, but they seem to bioaccumulate, have more BPA in their bodies. These are the more severe cases. Maybe they are not as good as other women are at detoxification and getting this endocrine disruptor out of their bodies. Also, we know that women with PCOS in utero, when they're actually brewing in their mom's uterus, babies in utero bioaccumulate BPA more than the mother, many fold times higher levels of BPA in the fetus than in the mother. And they've shown that fetal exposure to this endocrine disruptor, and I'm sure others, can alter the way that estrogen receptors form during the embryological and fetal time when you're developing your endocrine system. So estrogen receptors in women with PCOS tend to be malfunctioning. So they're just not working as well. So the estradiol that is made by the ovaries doesn't even optimally turn on the receptors to create the wonderful effects of estradiol in the body. So that's a next whammy, you might say. So endocrine disruptors exposed women during the fetal time and during the critical times of like puberty and so on, and then throughout even adulthood, women with PCOS are modified by these endocrine disruptors. So should we call that estrogen dominance? Because they tend to bioaccumulate more of this toxic endocrine disruptor, BPA, and maybe others? That doesn't make sense because people don't know what you're even talking about when you say estrogen dominance, that it could mean they have more endocrine disruptors in them. So what do I suggest? Let's just put that phrase to rest. Let's bury it. Don't even leave a marker. Let's just move on. Okay, let's call what is what it is. Let's use a little bit more of a descriptive explanation, because estrogen dominance, and particularly when it's being used for women with PCOS, is so confusing to patients and healthcare providers alike. Let's just call what is what it is. Women with PCOS, to summarize, women with PCOS do not produce enough estradiol from their ovaries. Women with PCOS tend to produce too much estrone due to systemic inflammation, upregulating the enzyme aromatase in adipose tissue. They produce too much estrone. Women with PCOS may have malfunction to some degree of their livers. Non-alcoholic fatty liver disease, also now referred to as hepatic metabolic steatosis, is common in women with PCOS due to gut dysbiosis and abnormal gut microbiome and problems with liver, and that can cause fat accumulation and can impact detoxification pathways. And estradiol is detoxified primarily in the liver. It starts with some detoxification called phase 2 detoxification in the intestinal tract, and then phase 3 and 4 occurs in the liver. And there's further action in the intestinal tract where you have what's called the estrabolome. These are microbes specifically embedded in the gut to work on estradiol, okay, for elimination and sometimes appropriately, sometimes inappropriately, recycling estrogen back into the circulation from the gut. So we'll talk more about estrogen metabolism another time as well. But women with PCOS do not make enough estradiol. They make too much estrone. They may have some difficulty optimizing detoxification pathways of estrogen through their liver and gut. They may bioaccumulate more endocrine disruptors for estrogen and other hormones. We call them, when it's referring to endocrine disruptors for estrogen, xenoestrogens. And each woman who has PCOS is going to be unique. Some may have more of one or the other. We have to really learn each woman's unique situation. So we want to explain what is happening. Using the phrase estrogen dominance is so confusing, and the problem that I feel is huge is that the takeaway for many people is that estrogen in the form of estradiol, although it's not usually spelled out, but the estrogen made by the ovaries is somehow bad. It's evil. It perpetuates this whole misunderstanding about estrogens in general. So let's forget that expression, estrogen dominance, and just understand what's happening in women with PCOS. Thank you.